I'm Con Kelleher. I'm a consultant obstetrician and gynaecologist, and I've been at Guy's and St Thomas's as a consultant since 1998, getting towards 20 years. It's a long time. And I've been looking after private obstetric patients for the last 20 years. I think what you have to look at is the bigger picture of why would you have a private maternity unit here. When you have a baby, there's lots of things that you expect and lots of things that you don't expect. And therefore I think it's probably most important to have your baby within a proper hospital where you have access to all the things that you perhaps never knew that you needed, but doing it in a level of comfort with lovely views, nice staff, a comfortable way to recover. Well, in terms of safety, we've based our private unit within the big NHS hospital, so we have everything. I can't think of anything that we don't have at Guy's and St Thomas's that anybody could need if they're having a baby. We have a fantastic special care service, which people often forget that the baby actually is a patient too. A lot of people will think of other hospitals where they may have their private obstetrics. We have a very good core staff. We don't rely that heavily on agency staff, and people work within the system. They know how the system works, and I think safety is paramount. I think a lot of people, when they book for obstetric care, generally think that they're having consultant-led care within the NHS, but unfortunately they're not. The consultant will have their name attached to lots of patients. They'll obviously still work within the NHS, which is how we all keep our skills up, but doing the difficult things perhaps. Within consultant-led obstetric care, you book with a consultant. You see a consultant all the way through. You'll have your appointments with consultants, and you'll give your consultant a call when you're ready to have your baby, and they'll be looking after you during labour. That's proper consultant-delivered care, and I think it's a good package. Yeah, no, well, when you sign on, we'll give you our mobile numbers, our emails, the contact with our secretary. We don't expect you to call us all the time. There's text messaging. A lot of patients actually WhatsApp me. So we have any system of calling that you'd like to use, really. I think it's the best. I think it's one of the best hospitals in London. It's where I'd send my daughter to have a baby. I'd like her to have one person who's going to be ultimately in charge of making sure that it goes well for her. I think you need to have somebody who's looking out for you specifically, who has the ultimate responsibility for making sure that all goes well. And I'd like her to have access to all the things that she never knew she needed. When I see my private obstetric patients for the first time, I don't take them to see the intensive care unit, I don't take them to see the special care unit, I don't take them to see the blood transfusion, the interventional radiology, but just the comfort of knowing that they're there. And we have wall-to-wall doctors. Remember that we deliver our patients privately on a busy obstetric unit. You push an emergency buzzer and it's not just your consultant, you have a whole team of people who are there.